Welcome to Superheroes of Science. I'm Stephen.
And I'm Sarah. We co-host Science from the Experts. Our guests are professionals doing cutting-edge science right now.
They're experts in their field discussing what they know best. So listen up and learn real science from real people.
Subscribe now and stay informed of our latest episodes and show your support.
Joining us today on Superheroes of Science, we're excited to welcome Scott Lawrance. Scott is a clinical professor in the Department of Health and Kinesiology here at Purdue University, and also the Director of Athletic Training Education. So welcome. Thanks for being here.
Absolutely. Thank you.
Yeah.
We appreciate you taking the time. And I'm guessing since you're in charge of athletic what now? Athletic education? Training?
I'm the director of athletic training education. We have two athletic training programs, one at the professional level, one at the post-professional level. We are the entity that educates those individuals looking to go into that profession. Athletic training is a healthcare profession. We take care of active individuals. And so the easiest way I can explain that is when somebody gets hurt out on the field or out on the court, or even just in everyday life, and you see someone go out on the field or the court and help take care of them, that's us. That's who we are. And so our program has been around for a number of years. We've been highly successful in educating students, placing them into the workforce, and really excited to be a part of the institution offering those two programs.
Oh, awesome. And so I know when we contacted, one of the things we talked about is like, hey, a lot of people want to do strength training programs and stuff, and we'd like them not to need rehab when they're done.
Absolutely. That's the goal, isn't it?
Yeah. And so maybe some tips and stuff about how to prevent being one of your research people, because I see you've done several publications on different things as different injuries and rehab, and it'd be nice to avoid being one of your people you're doing research on.
That would be great. Nobody wants to be that person, right? Nobody wants to be involved in the study that was, how did you get hurt? We all want to be involved in other things, right?
And so what would some suggestions or tips that you might have to people, because let's face it, it's a lot of us. I mean, summer was busy, we got kind of active. Fall, we started winding down. Winter starts and we just kind of drop it. And so we want to start getting back in shape, and all of a sudden, and jump right in with both feet. And what's some tips and suggestions you might have for somebody wanting to do this?
Yeah. Well, I think this is a perfect time of year to have this conversation, right? Because there is going to be a lot of us in that same boat who are either taking on new resolutions or trying to make lifestyle changes. And the big piece or the big key is, how do you do that safely? And where I always like to start is a conversation of what's an injury versus what's normal soreness that you should expect, because you should expect some changes. And one of those is going to be normal muscle soreness from any type of change in what you're doing. Let's face it, a lot of us in this last quarter of the year, we have other responsibilities. And it's one of those things where physical fitness a lot of times takes that back seat, as you mentioned. And so as you start something new, or you get into something that you haven't done in a while, there are going to be some adaptations that result in soreness, and that's normal. You should expect that. That doesn't mean that you're injured. It just means that your body is starting that adaptation process. And that usually lasts between 1 and 2 weeks, sometimes a little less, sometimes a little bit more, but that's normal. And that's what I want to underscore. That is a normal, typical response. I think the issue that I've seen is for anyone who's taking on something new, they don't know that is normal. And they either need reassured, or sometimes they even get scared away from pursuing because they don't want to, be hurt. That's one thing. Now, the second piece is if you actually get injured, and there's some things or reasons why, and I think that dovetails into some of the tips that I would suggest. The first one is we often see injury as a result of poor movement. And poor movement quality in an individual, meaning you're trying to do something you're just not ready to do or able to do at that moment. For me to go out and try to run a 5K right now, I'm probably not in good enough shape to do that. I might want to do that, but I'm not ready to do that. And so I need to be smart about my training and be gradual about how I build my intensity and how I build my volume. If I'm in the weight room, maybe I want to do an exercise that I just don't have the range of motion to do. And I put myself in a bad situation. And that bad situation could just cause an overuse injury over time, or it could cause an accident. And certainly accidents happen in the weight room and in the training facility. And that's where you might have an injury is with that accident. The other thing that I think happens is, over time you have this lack of training or conditioning base to really move you where you want to go. And it's just being smart about progressions, like I mentioned, and undertaking a planned progression of activities, whether that's biting off a little bit more each week, or whether that's working with someone who knows what they're doing and can help guide you on that. Those are the big reasons that I see people getting hurt. And I think, from that, you can really keep yourself out of my office by just being gradual, by being smart, being intentional, I would say, about how you progress, how you load with both intensity and volume.
Those are both really hard things to do sometimes. I know myself, I'm both macho and competitive. And so I want to be able to go there and beat my chest and do the same as the people who haven't taken a year break. And I guess I ended up with a slip disc in the back. It's a little bit too big of weights. And then the others, I know I've hurt myself with. I like where you say, starting gradually. I know I tend to be an all-in type of person, and so that's something that's difficult for me that I need to work on, and myself too, is going gradually and not going all in. And that's where I spent several months limping, because I decided to go all in.
Yeah. And I think it's okay to be all in, but you have to be smart all in.
Mhm.
Right. And you have to have a plan, and it's easy to get competitive. We all do. And as you get competitive, I think be competitive with yourself. Don't be competitive with other individuals that you might be comparing yourself to, because you don't know their training history. You don't know their potential medical issues or lack of medical issues. They may be able to do something that you can't, just because of how their body works and how your body works. And if you're competitive with yourself, kind of week in and week out, then I think you might be able to temper that down just a little bit and help to control that. But be all in, be that person that is out there and really gung ho, because that's going to help you stick with that routine. It's going to help you build consistency over time.
I like that.
You had mentioned the being, let's see, poor movement can contribute to injury. And then also I had heard you mention overuse. And are there resources or, some place we could go to visit to find correct movement, or people we could talk to learn sort of the proper movements and things if we're wanting to begin a new program?
Yeah, certainly there are resources available. And if you do an internet search, you can probably find 1,001 or more articles and opinions on what the best way to do that is. I think, the big thing is you want to consult with someone who has a background, and you want to have somebody who has a knowledge of movement, what is appropriate and what's not appropriate, because this is something that it's really easy to get a bunch of different opinions on. And so, this is not something that you want to trust to your uncle or your aunt who has a casual interest in this. You want to have someone who is trained, and that would be someone like myself, an athletic trainer, a physical therapist, a personal trainer, someone who has an appropriate fitness background and a movement background. And I would consider all of those professions to be experts in movement. And so if you go to a local gym, they're going to have someone like that available that you might be able to have help you in an initial session or an initial couple sessions, just to help determine what is your movement patterns, what do they look like, where are you in a where are you in good shape and where are you maybe not in quite so good shape. Maybe you have difficulties with some of your squat mechanics, and to put a heavy load on a squat bar just doesn't make sense right now. Maybe we need to alter that and do some different exercises. Or maybe you don't have the shoulder mobility that is required to do some of the Olympic weightlifting that is fairly popular. Those are things that I think if you know that on the front end of your program design, you can really help ward off a lot of injuries that might come on the backside.
I think that's a really good point, that speaking with professionals that can help you at the initially as you develop a plan, and could just seems like it could really pay off big in terms of not causing yourself injury and preventing that.
Absolutely. And I can't stress that enough. I mean, it sometimes is you're so ready to go and you're ready to get into the gym, and you just want to start, right? And maybe this delays that by a day or 2 or 3, but I think the time you invest into this will pay dividends, many times over as you're looking progressing through the program long term.
What are some of the most common injuries that you're seeing?
So I think one of the things that you typically tend to see is a lot of overuse injuries in the muscles. You see a lot of sore joints. So typical injuries that you might see would be rotator cuff tendonitis or tendinopathies. Sometimes you'll see biceps tendonitis. You'll see quadriceps tendonitis or tendinopathy. You'll see problems with the Achilles tendon. So the common theme here is you're seeing a lot of muscles that transition forces from big areas into the extremities. So if you're involved with weightlifting, for example, you might start to experience shoulder pain, and that could be coming from your rotator cuff or your biceps tendon. If you're doing a lot of squat mechanics or lower extremity work, you might start to develop some of those patella tendon type of conditions, or maybe something in your Achilles from running and starting some type of a couch to a 5K plan, for example. So those are the most common things that you see. And then of course, accidents happen, and you might see, you mentioned a disc injury, a low back disc injury earlier, and those happen. You can see a full range of issues, whether it's a joint issue or whether it's a cartilage issue. Those certainly happen when those rare accidents occur in a weight room.
So how do I know? All right, let's say I remember bench pressing in high school. I know how to do that. I grab that bar, I do a few rounds. Next day, my shoulder hurts like crazy. How do I know? Am I just sore or am I hurt?
Oh, geez. So that's a great question. You're flipping it back around on me. I love it. So I think this is where it's hard to give individual advice in a group setting, right? So I think there are a couple things that you can look for. Number one would be pain that is just really disproportionate and is not improving over time. So your typical soreness is going to start to get better. It's going to be a little bit better 12 hours after you first notice it. It's going to be a little bit better 24 hours later. It's going to be a little bit better 36 hours after the initial onset. So it's progressively getting better. That's different than the pain that is really there and it's unrelenting. So that's one thing I look for. Number two would be any type of noticeable swelling. So if you're getting swelling in an area, that's a sign that there's been damage, and that could be in a joint or it could be in soft tissue. So the third thing that would differentiate soreness from an injury is really a loss of range of motion. When I look at somebody and I see that they have a marked decrease in how well they move, maybe they're only able to move half of what they could before, or maybe even close to what they could, but it just really hurts, especially at end range, that's a sign of an injury. And that's something that we really need to make sure is looked at by someone who knows what they're looking for.
Oh, well, that helps because I mean, yeah, you're going to have some soreness if you've done things you haven't in a long time,
Mm-hmm.
but then it's easy to get scared for a lot of people. Some people don't live for the pain. Um, but it's like, yeah, this is wrong.
Hmm.
And
Yeah.
so it's nice to know when it really is wrong.
Yeah, and like you said, it's really easy to get discouraged, and I think that's something that we've all faced at some point. You don't do something for a while, you go out, and it could be something simple. It could just be yard work, right?
Mhm.
And the next day your back hurts, your leg hurt, and the easy reaction is, I'm not going to do that again. But you start feeling better. That disproportionate pain starts to decrease. Any swelling that might have been there goes away. Loss of range of motion comes back. That's just general soreness, and you're safe to go back and resume activity again. It's when those things persist and last that you should start to worry.
Very nice.
Now,
Thank you for explaining that a little bit better.
Yeah.
yeah. I noticed in you that some of your research interest lies in limb symmetry and using
Yeah.
predictor of, risk of injury. So what is limb symmetry, and how do I know if is there a way I can check myself for this? Or
Yeah. So limb symmetry is the you're speaking my language now. I get really fired up about this. So when we look at risk of injury, let me start here. This is the number one thing that we can control. The risk factors for injury, number one is you have a first injury. So when you have an injury, your risk of subsequent injury starts to go up by many factors. One of the things that we can control, because we can't really control if you had a first injury, right? One of the things we can is the degree of difference between the two limbs. And that's what symmetry is. How well does your right and your left look? Do they look the same? And so we call your lower extremity symmetric if you have very little difference between the two across a whole host of measures. And that's everything from swelling to motion to strength to balance to proprioception, to a whole lot of different things. If you have large differences, you start to have what we can almost say is just two different legs. And when you have two different legs, you treat them differently. And that means that you're gonna bear the risk of injury in one leg over another because one feels a little bit better, one jumps a little bit easier, you can reach a little further with balance, and that limb tends to be at a little bit higher risk. And so we do see risk of injury start to go up when you have a higher degree of asymmetry or lack of symmetry.
And so is that something that someone might want to look out for, to start to see if they notice those big differences, and to be training to try to get them a little more? Because first thing when I'd read the symmetry, I'm like, okay, are my arms the same length, and I'm like, well, what is this? It's but it sounds like it's that's not quite where you're going with it.
Yeah. So I think first of all, normal people have good symmetry. You don't inherently treat one leg different than the other. And so if I were to pull a whole bunch of people off the street and test them, they should test pretty similar side to side. And we see very, very small differences of 5% or less across any measure that we can look at for the most part. There is some variability sometimes in strength, and you may say, I have one leg that feels a little stronger. You
Yeah.
might actually have that. We see some variations in strength of up to about 20% sometimes in normal people who've never been hurt, who have never had a problem. But outside of that, the differences are very, very small, and you're not even going to perceive those. Now, when you go out and you start to train or you start to get involved in sport or activity, it is important, I think, to know what your limb symmetry is. And that's part of what a preseason physical is all about, trying to determine. And we do the same thing for the upper extremity. My focus is on the lower extremity, but we're trying to identify what are those areas where you might be at risk for injury. And so if we're expanding this into a general population, someone who's starting activity for the first time, while I wouldn't expect there to be asymmetry is present, I think it is smart to have someone look at that. And that's something that you can do in a lot of ways. There are some really low cost, very easy to do measures that you can look at. Things like single leg squats and how well you can balance while you're standing, feet together and feet in line, and so on and so forth, that you can now look at and see, am I at risk for being injured? Then if there is a difference, you can work to minimize that. And that's where someone like me comes into play. Someone that can really identify the root cause of that difference and give a good guided plan on how you can address that.
What are some of the causes what are some things that might cause an imbalance?
So great question, great follow up there. I think the number one thing is going to be some type of injury or compensation. I'm a cyclist, and every so often when I do hill work, my right knee gets sore.
Mhm.
And when my right knee gets sore, I know it changes the way I walk, the way I go up and down stairs, right? And so that can cause over time a change in my symmetry. That may change the way I use that right leg. And therefore, because I'm not using it, I start to lose strength there. Because I don't trust it, I start to lose balance. Because I am not using it, now all of a sudden, the left leg starts to become the predominant leg when I do things. Now, I'm aware of that. And so I have strategies to mitigate that. And that's where an athletic trainer or a physical therapist can really help in terms of, knowing what those triggers are and how you can then address those.
You don't like take the right pedal off and just pedal to the left one, do you?
Now, if I'm doing some power workouts, absolutely. If I'm trying to work on some single leg stuff, yeah, you got me there. But yeah, I think compensation is probably the big one that I see in terms of those big triggers that would cause an asymmetry. And it's those single leg activities. If you're always squatting a certain way, if you're always jumping a certain way, if normal people don't do that. Normal people will use the right leg just the same way as they use their left leg for the most part. It's when you start to preferentiate one over another, now you start to do that. And single leg cycling, that would absolutely do that.
But I've caught myself doing just what you're saying, where you start to favor one way because you're in a little pain, but then once I was over the injury, the pain was gone, it became habitual.
Yeah,
And so I had to
absolutely.
consciously break myself. I'm like, this is not, I'm messing up my gait. And so I had to consciously force myself to change because I realized I was doing it.
And it's little things as well, subconscious things. Think about the way you stand. Most people are going to stand on one side and then subconsciously they shift over to the other and they just go back and forth side to side. Well, if you have one limb that hurts, if your left leg hurts, you predominantly stand on your right leg. And what that teaches your left leg to do is to not accept load. It actually causes a loss of motion at both the ankle and the knee. And now you start to accumulate some of these really small differences that over time can add up.
Well, those are good things to look for. It's because I could definitely see an imbalance causing other problems.
Yeah.
And you hit it right on the head there. It is an imbalance that leads to problems and eventually potentially injury.
Now, one of your research things I saw it said something about a backpack.
Oh boy. Yeah.
Yeah, I know you weren't first author on it, but it was
Mhm.
you were listed as an author. Something about
Yeah.
a backpack. Is that a regular backpack or is this something jargon?
Yeah. So that was an interesting study, and this was done a few years ago. And what we were looking at is how does an external load change balance? And the application is in the military and in tactical athletes, as we call them. And that's your police, your fire, your first responders. They're carrying heavy loads. And oftentimes this is in the form of a backpack or some type of a bag. And so that's going to change how they move. And that external force maybe causes them to not only balance differently, but move differently. And so that study looked at the impact of different weights on an individual's balance.
So let me throw one at you that you might be like, don't go there, man. But I'm gonna try.
Okay.
Because I have some friends and I'm jealous. I want one, but I can't give up the money to buy it. But they do the weighted vests for their training. Thinking it's okay. It's you have more weight, so you're good or bad.
Not good, but not bad. So I'm going to give you a big old, it depends. And it depends on the person. It depends on the activity. I'm not sure that I would be advocate for high intensity plyometric activities with a weighted vest on, but it can be of substantial value for a lot of activities. I use them myself in rehabilitation a lot. So I don't think that they're bad, but I think there needs to be context to that question or context to that answer, maybe.
That was a safe answer. That's fair.
I feel like that's fair. Yeah.
Throw that one right down the middle, let it have a little latitude to the left or to the right.
Well, I got this is a bit unrelated, but it's kind of related in the sense of it deals with some pain and things. So I understand like sometimes soreness can be, that can be part of just getting back into it. And definitely if there's injury, there's, the persistent pain and it doesn't go away and that sort of thing. What about, or maybe I'm just a weird person, I don't know, but occasionally, like if I'm running or if I'm doing some kind of workout or something and I'll get a pain. And it's like this weird, it's like a phantom pain. It's just in like maybe like the top of my foot or in my knee maybe. But then like 2 days later, I'm told it's gone. There's nothing, there's no residual pain. It's what on earth is happening? Why?
Yeah, I wish I could give you a good answer. I don't know that I can,
Okay.
Because we have this old saying in class, and I heard it throughout the entirety of my training, and every professor gave me the whole "it depends," and I think that is the most common answer given in any type of rehabilitative setting, right? Because it depends on a whole host of things. Now, relative to what you're saying, that is common. A lot of people will say that. Typically, that is something mechanical in your body. You're getting impingement of tissue or impingement of bone, where something is touching that is not supposed to. For example, this happens to me in my hip. So in my hip, if I get into too much hip flexion or too much hip rotation, I'll actually have some bone hit bone, and that is very uncomfortable. And it's uncomfortable for a short period of time. And once I'm done with the activity, it goes away and then I'm just fine again. And it's very rare. It's very occasional, I guess I should say. But it's one of those things that it's like you were saying, it's there and it definitely bothers you, changes how you do things, and then it goes away just as quick as it came.
All right. Okay. I want to throw one at you. Another one. This is fun.
I don't know
for you guys.
Yeah. Is I listen to a couple of different fitness podcasts.
Yes.
And one of them I was listening to is this probably a year ago, but it's got me thinking ever since then. It's kind of stuck in my head. It said, well, how do I say this without using the cuss words they used? The rice, the ice part of that is bad. Well, I said that totally professionally. I'm so proud of myself. So the rice part, they said it's actually counterproductive to the healing process, where you don't want to put ice on it and delay the blood getting to it. Are they right? Yeah. Are they wrong? Where do we stand?
Yeah. So let me start off with some of the literature. There are a lot of people questioning the use of ice, and this has been a standard of the athletic training and physical therapy worlds for years, and that comes from a lot of really good sound research. And what they're questioning is the effect of the cold application on the inflammatory process, because you have to go through an inflammatory process to progress towards healing. Now, I think the issue is the all or none, in my opinion. So people are saying either yes, you do it, or no, you don't. And there are more people now saying no, don't use it. And I think for the individuals in that camp, one of the things that they're overlooking is that first 12 to 24 hours where you run the risk of secondary hypoxic injury. And without the application of cold or ice in that first 12 to 24 hours, you can actually cause more damage, because what happens is you get the ingress of swelling that starts to suffocate the tissues that have been damaged. And now you get the good tissues on the periphery that become a casualty or collateral damage. Ice can control that in the initial stages. Now, once you get through that, should you continue to ice? That's where I think there is some validity to that argument of you shouldn't be using it, because if you're continuing to suppress that inflammatory response 24, 48, 60, whatever hours later, that can, I think, slow down recovery. And so I understand where people are coming from with that argument. I don't think rice is dead. Anecdotally, this has worked extremely well for close to 100 years or more. But I do think there is some strong rationale to say maybe there's a better, smarter way to use this. And once we get through that initial window, there might be other agents that can work better.
That makes a lot of sense.
Yeah, it makes sense when you say it that way.
And again, that I think people get into this all or none mentality. You either use it or you don't use it.
Yeah.
And I think it's more nuanced than that. Nothing in life is that simple, right? So I think, using it in that first 12 hours, maybe even 24 hours, suppress the initial swelling to control for secondary hypoxic injury, get the side benefit of some pain control. And then once you have progressed through that, now you can start to look at other agents, whether that is the use of heat, whether that's the use of compression, whether that's the use of movement. Lots of different options there available to you.
Well, that makes me feel much better. Okay, well, I was struggling with it because, but like you said, it's a lot of people get stuck on it's all or nothing, and that's where they were. They're like, "Oh, you shouldn't do it at all. It's nothing." I'm like, "Oh, well, the arguments they make, that sounds okay. Yeah, okay, I can see it. Okay."
Yeah, and it's valid criticisms. They have some really good data behind those arguments, but I think the problem, just like with a lot of studies, is sample size and longevity. So small samples over a short period of time often don't yield the same results as big results over long periods of time. And you get every kind of mixture in between there, and that's where I think the nuance is when you're treating individuals.
So did you have something, Sarah?
No.
Okay, I'm like, oops, I cut you off because I asked the last one. I want to ask about fad exercises.
Okay, there's a lot of them.
Yeah, I know, and it's everything from the Thigh Master to I don't know what, but go back to the old ones there.
Yeah.
Should people be concerned and quite leery of these, anything like this, or is it? How should a person approach? Because right now I'm already seeing advertisements in like all my apps and everywhere. I'm seeing these advertisements for all these, and I'm like, well, there's a fad exercise. Yeah, that'll be around for a week, but it's how do you? But when I'm sitting there rowing at the co-rack, I'm sitting there rowing on the machine. I see the TV, the little flashy box in front of me, and I'm like, wow, that might really work. And so, how do we approach those? How do we mentally deal with this bombardment that we always get the first of the year?
Yeah, we get it every single year, right? Every year it's something new, and I think I'm at the age now where I'm starting to see everything repackaged. So everything from the 80s is coming back now, and people think it's new, and it's really not. But the younger generation doesn't know the difference, right? So you put on a nice marketing scheme, and you can make a lot of money on some fad exercises. I think for me, I'm always wary of the programs that promise everything. And generally, when you have a program that promises everything, they're not able to deliver on anything. And that's maybe a little bit of an overstatement on my part, but it holds true in a lot of cases where, we can reshape your body, we can curb your appetite, we can do all of these things with a pill and exercise twice a week. Well, I think my bottom line is there are no shortcuts for this. And good physical fitness includes multifaceted, multidisciplinary effort, and it's effort over a long period of time, and it's little by little approach, and there is no magic pill, there is no magic exercise. And the pills and the exercises that promise short-term results with little effort oftentimes fall into that fad realm. And I think you just have to be a little cautious of that. Most of the time, these fad exercises are not dangerous per se. And so, I'll be honest, that's how we advance. We have to be able to try new things, right? So I'm not against, the newest, latest, greatest exercise and the newest, latest, greatest idea, but I think we just have to have a little bit of skepticism and beware of the overpromise.
I love that you mentioned there are no shortcuts, that it's to be in it for the long haul. It takes time and that dedication and over the long term, and
Yeah.
you can't just take a magic pill.
You're absolutely right. I think like a lot of people my age, when I hit that 40-year mark a few years back, it was one of those eye-opening moments, and it was a wake up that maybe the lifestyle I was leading wasn't going to be the lifestyle that I wanted,
Yeah.
as I moved into middle age. And I had to make some changes, and I did, and it took sustained effort over a long period of time. And here I am, I've been in the industry for 25 years at this point, and gosh, I should know that this takes a while, but I was so impatient and I was so wanting this to just be a 1 to 2 week type of thing. Of course it wasn't. It was, a 1 to 2 year type of thing. And that's the way that I go about things. But, it was very much, the journey was very much worth the effort for me.
Okay, so you're telling me that there's no magic pill, and I'm gonna probably feel some soreness if I'm doing this right. And I've got to stick with this and potentially even, 1 to 2 years. Is all of this worth it?
Well, yes, it is worth it. So we know that physical fitness, your strength, your cardiovascular function, we can tie so many attributes to longevity, to quality of life, that it's no doubt that this is absolutely worth the effort, not just to get to your optimal fitness, whatever that may be. For some people, that's going to be much lower than what it is for others. But once you are there, maintaining that level of fitness, absolutely worth the effort. And by the way, to maintain it is always much less effort than to get there. I think that's something that a lot of people get discouraged because it took so much effort to get to where they're at. But I promise it takes a little bit less to maintain that over time. But those are all tied to longevity, quality of life, being able to do the things that you want to do as we all inevitably get older, whether that is walking on the beach, whether it's going to the theme park, whether it is doing sport and activity, gardening in the yard, whatever the case may be. The more time you invest into physical fitness, the more that will pay dividend down the road.
I think that's a big way that we have to look at is like you said, you spend a little bit of time now to get a lot more time later.
That's a great way to put it. Yeah. I mean, it's a little bit of a pay me now or pay me later. Which do you prefer?
Mhm.
And I'm of the mindset of, I'm ready to put in the effort now because I want to enjoy the later.
Yeah, that's definitely where I am too. Well, this was really good advice, and we appreciate your time.
Yes. Thank you so
Absolutely.
much. This is wonderful.
Absolutely. Well, always happy to talk about these types of things. I think, physical fitness, staying healthy, recovering from any type of illness or injury. Those are topics that a lot of people worry about, they stress about. And, anytime we can provide some answers to folks, always happy to share what we can.
Thank you for listening to this episode of Science from the Experts from Purdue University Superheroes of Science.
If you like this episode, subscribe, give us a positive review, and share the love. Boiler up!
Hammer down.